All right, so just a few more seconds, and then Dr. Bill, I'm going to do a little introduction and we'll get things going, okay? Sarah, welcome. Jerome, welcome.
Thank you.
All right, so good evening, everyone. My name is Salvatore Seely. I am the Health and Wellness Program Director here at Camp Rehoboth. CAMP is an acronym for Create a More Positive Rehoboth, here in Rehoboth Beach, Delaware, serving the LGBTQ plus community. I'm so glad that all of you could be here. This event is sponsored by the Camp Safe program, which is our HIV prevention program that serves people in the eastern part of our county and also the western part of our county. Tonight, we are Facebook live streaming this event. So if you have questions and you don't want to be on camera, you can put them in your chat box. If everyone can turn their cameras off and just put themselves on mute just for the first part of the presentation, that would be great. We'll have question and answer time at the end of the conversation. So tonight's PrEP Talk is a series of 3 conversations we're going to have about PrEP and sexual health. And the informal discussion, very informal, will be led by Dr. William Chasanov. Dr. Bill is an infectious disease physician at Beebe Healthcare. He grew up in Milford, Delaware, and currently lives in Lewis. He completed internal medicine training at Christiana Care and infectious disease fellowship at Cooper University Hospital. And again, at the end, we will have time for some questions. I will also talk about some resources, as will Dr. Bill. And again, if you're just joining us, please put your audio on mute. And with that, Dr. Bill, thank you so much for being here. And I'm going to spotlight you, and we really appreciate your time. Thank you.
Thank you, Sal. Are you able to hear me?
We're good to go. Thank you.
That's great. Thank you. I want to, towards the end, introduce some colleagues that have joined me from Beebe Healthcare, which is where I work. So at the end, I will give another shout out to Dr. Sarah Matthews, who is a new colleague of mine. So I talked to Sal a couple weeks ago, and he was gracious enough to invite me to talk to all of you, at least virtually through, through Zoom, about PrEP. And some of you may know a little bit about PrEP. Some of you may be experts on PrEP. So if there are questions, Sal has opened up the chat box, and feel free to enter those questions, and he's going to be kind enough to screen those for us. So I do want to spend a few minutes. I did not do a PowerPoint or anything formal. This is quite informal, but I did want to ensure that I get some important information out that I think everyone will be able to walk away from this Zoom meeting and conference with some ideas, at least of what PrEP is and where to find some additional information. So PrEP is an acronym because we like to acronym everything in this world, and especially in medicine, and it stands for pre-exposure prophylaxis. And pre-exposure prophylaxis means basically that it is something that can be done to decrease one's upcoming chance of potentially getting something. So in this case, more specifically, what can we do to decrease our chance for HIV transmission? And this is before the fact of becoming or moving forward with that risk. So what can I do now to avoid having that risk of HIV in the future? When we talk about PrEP, we are generally speaking about HIV, obviously, and we're talking about normally what type of medications someone may be a candidate for that will reduce their risk of HIV. Currently on the market, there are 2 medications that are approved for PrEP, so for HIV PrEP. One has been around for several years and actually more than a decade, and that is called Truvada. Truvada is a combination of 2 medications. One is tenofovir, and the other one is emtricitabine, and I don't expect anybody to remember that. What is important is that Truvada, while not alone, but Truvada combined with other medications is still one of our mainline or mainstream regimens that actually do treat HIV. Again, Truvada alone does not treat HIV, but in combination with other medications is used for HIV treatment. So Truvada has been approved for PrEP for several years. And Truvada is kind of our tried and go-to where many of the studies have been performed here in this country and in other countries about how it can decrease the risk of HIV transmission. There's a new formula of Truvada, or at least what I like to consider a new formula of Truvada. I told you that was made up of two medications, one called emtricitabine that I don't expect anyone to remember, and the other is tenofovir. This other medication approved for PrEP is called Descovy, and it actually has a new formula of tenofovir that actually allows the person to get a lower dose, which in turn over time can reduce some of the medical issues that we see with Truvada that not everyone will have, but some people will. And those generally are things such as bone density decreases potentially over years of use of Truvada. And also we have to monitor people's kidneys pretty closely when they're on Truvada as well. Descovy, we still need to do those things, but it is significantly less likely to cause those issues. There's a little bit of a nuance. Truvada is really, like I said, the tried and true. We have lots of studies on Truvada. Descovy is newer, so it actually does not have all the recommendations for everyone who might be considered for PrEP. But that's something that you would talk to your healthcare provider about. That's not something that you would make on an individual decision. That is a group decision with whomever's prescribing your medication. So PrEP, PrEP is not just approved to decrease the risk of HIV transmission from sex, which is what most of us think about, but it actually does have an indication to decrease the risk of HIV transmission for those who do use intravenous drugs. So that is something that is important. I used to work at Cooper University Hospital, and I had patients that were on PrEP because they were intravenous drug users. So I do think that that is a nuance because it is pushed, or at least a lot of the information that's put out there is that people think that it's only to decrease HIV transmission from sex, but it does have other indication as well. Honestly, some studies show from a HIV transmission from sex that you can reduce the risk by up to 99% if you use Truvada or Descovy appropriately on a daily basis. I mean, that's pretty amazing. There are pretty few things where, you can reduce the risk of something by that much. Now, those are some studies. Consistently, studies show that reducing the risk of HIV when using Truvada or Descovy are definitely in the high 80s. But like I said, the CDC publishes information from studies that say up to 99%. Now for intravenous drug users, that is not as high. We realize that it's only up to 74% when people use PrEP for, that are using it to decrease HIV transmission in the setting of drug use. So it does have to be used on a consistent basis, and in order to get those statistics that I shared with you, it does generally have to be taken on a daily basis. It does have to be taken for, for a certain amount of time, and your provider would talk to you about that. Believe it or not, if you engage in anal sex, then you really need to be taking this for about a week. But vaginal sex is actually up to about 3 weeks to really get the right amount of concentration of this medication into the right places. So that's all really important to recognize that that's why PrEP, when they say is taken appropriately, has an effectiveness when it comes to sex up to 99%. But if you're not taking it every day and you're not taking it for the time before you have that high risk encounter, it's not going to reach that 99%. This is a good leeway into one of the questions that I get asked very frequently is, if I'm taking PrEP and, I'm worried about HIV and I'm taking it right, I'm taking it daily, do I need to use condoms? So the answer is yes, because what's really important and what I see in my practice and we are seeing kind of in the country is that as people are taking PrEP, they feel that while they are safer from the HIV transmission risk, we are actually seeing a rise in other sexually transmitted diseases like chlamydia and gonorrhea and syphilis. So remember, this medication that we're using for HIV transmission that we're calling PrEP does not protect people for chlamydia, gonorrhea, and syphilis. I should say and or syphilis. So please keep in mind that condoms and other safe sex measures should still be taken. PrEP does not kind of open up the world that you can't get, all the other things that we're concerned about. I also want to spend just a couple minutes to talk about what PrEP is not. So I'm going to talk a little bit about a fine line here, if you'll bear with me. So I told you before that PrEP is considered pre-exposure prophylaxis. So that is something that we would start taking before we came into a high-risk encounter. But there is something called post-exposure prophylaxis, and that basically is our fancy term that someone who is not on PrEP ends up having a high-risk encounter. That could be a sexual encounter. That could be from a needle stick at work, depending on what you do. That could be from a shared needle in an IV drug user. If it's someone who is not being protected with PrEP and they do have an encounter, there are certain measures that we can offer to try to still decrease that risk of HIV. And again, that's called PEP. PEP, also known as post-exposure prophylaxis. That is not necessarily the focus of tonight's talk, and if anybody has questions, they can always reach out to me about that. I do think that that's important to recognize that there is something out there for that, and that people are not, if they're not on PrEP and they unfortunately have a high-risk exposure, be it from some of the things I discussed, there are certain things out there that may be able to still protect and reduce the risk of transmission for HIV. So strictly from the CDC, I'm going to give you sort of what they recommend people who should at least consider, taking PrEP. So I'm back talking about PrEP now, not PEP. So when it comes to pre-exposure prophylaxis, if you are in a relationship where your sexual partner has HIV and you do not, then that is one of the reasons that you should at least consider maybe taking PrEP. Not saying that you need to, but that's one of the reasons that you would consider doing that. If you are someone who engages in riskier sex, so you or your partner is not consistently wearing condoms, and that is another situation where you might consider that PrEP is best for you. If you've been diagnosed with an STD in the past 6 months, what we have found is that people who have been diagnosed with an STD, especially syphilis, in the last 6 months, do tend to have a higher risk of actually having transmission risk for HIV. So you would be someone who would be considered, or at least need to think of if PrEP is right for you. If you are an individual who shares needles, syringes, or other, equipment when it comes to drug sharing, or IV drug sharing, I should say, you should also consider if PrEP is right for you. And then if you are someone who has actually had PEP, now I'm back to talking about the post-exposure prophylaxis. If you are someone who has had PEP medication prescribed to you a couple times or more, you're someone who should maybe consider thinking about taking PrEP, because overall it's going to decrease your risk of HIV transmission. That's a lot of information, and that's a lot of information to digest. So think about that for a second, and if you have questions, let me know. If you are interested in PrEP, I think it's also important to spend a couple minutes to talk about how do you get started sort of in this journey. It sounds great, and I'm going to kind of tell you about where I think you should start. And then we can always, if there's questions about this, I can try to guide you in the best direction. First thing I would say is that if you're going to look for resources on the web about PrEP, Make sure that these are reliable internet sources. One of the places that I tend to go to is the CDC, the Centers for Disease Control. It's important at that point to recognize that they do have an entire section, and they have brochures out there, almost checklists out even for providers about PrEP and how to get patients started for me, but also as a patient who might be considering PrEP, necessarily what type of things might you want to think about to see if PrEP might be a good fit for you. When you look through those resources that are reliable, so I'm trying to send you to reliable resources, it's really important to see, to look through to see if you believe you qualify. And if you're not really sure if you qualify, or you're like, I do qualify and I'm interested, at that point, I need you to get hooked up with a provider who is in tune with prescribing PrEP. I'm an infectious disease doctor. I have been prescribing PrEP at least for the last 5 years. I feel very comfortable with this. There are some primary care providers out there that feel very comfortable with this. And then there are other primary care providers out there that are less comfortable prescribing PrEP. If you, and I think that Sal is going to be kind enough, if he hasn't already, he's going to put a website up here that's called preplocator.org. This by far is not the end all, but this will maybe start your journey as into who in your local area may be able to have these initial conversations at an appointment to discuss if PrEP is right or wrong for you. I do know that the Delaware HIV Consortium does have a PrEP navigation program as well, and I think that Sal can share some of those resources with you. At Beebe Healthcare, we do prescribe PrEP. Like I said, some of our providers are very comfortable with that, and some are less comfortable. But if you call, we will try to guide you. If we have openings, we will get you in. If we don't, we want you to get PrEP as timely as possible if you have interest. So there are times where we might use our resources at Camp Rehoboth and through Delaware HIV Consortium to get you hooked up as best as possible. If you do decide that PrEP is something that you want to talk to a provider about and you want to move forward with, I think that it's important to at least have an idea of what you should expect at that first visit. Because this for me would be a doctor's visit. If you come to see me, I'm a physician, you're going to get a physician visit. But it's not going to be necessarily like a wellness visit. We are going to be very focused on PrEP and the things that would influence if you should have the medication, if you should qualify for the medication, and honestly, how to get the medication if we meet those other 2 check marks. So you should be prepared to have really a frank discussion about your sexual history. No one is there to judge. We just need to make sure that we are doing what's best for you. Part of that is going to be history of STDs. If you have been tested for HIV in the past, and if you have, when was the last time you were tested for HIV in the past? And as silly as it might sound, I want to know the results of your HIV testing in the past, if you remember. There are certain medical conditions that I need to be aware of. If I'm going to prescribe you Truvada or Descovy, I need to make sure that I am not prescribing a medication that is concerning to you or I. I need to ensure that you don't have certain conditions, medical conditions, that this medication is going to be more risky than beneficial for you. So there are certain medical conditions that we'll talk about. That will also go with allergies as well, so it will feel very much like a medical visit, but just focused. You're going to be expected to have lab work done. And depending on where you go, some of that lab work might be done right on site. It might be done right in a lab, in an office. You might go to a hospital and have that done. You might go to a commercial laboratory and have some of that done. You might end up having some HIV testing done at Camp Rehoboth because it's free. And then you might have the rest of your testing done through, through insurance or through someone else. So just be aware. The other things that we do look at with that lab testing, and this is not a complete list, we look to see your hepatitis status as well. We look to see your kidney function. We look to make sure that you're not spilling protein in your urine. So if you also have some type of concern that I'm worried that you might have another STD like we talked about, chlamydia, gonorrhea, or syphilis, you should be prepared that we will test you for that as well. We overall want to make sure that you're as healthy as possible. So what I do might look a little bit different than what others do, but that I think gives you at least an idea of what you can expect. if you go through all that and your HIV test is negative and everything looks good, and we want to move forward with PrEP, I told you we'll talk about necessarily if the best medication for you is Truvada, or if the medication that's best for you is Descovy. And for some people, it really is kind of what medication we can get for you and that you qualify for both of those. We're a little bit luckier than we were a few years ago when it comes to PrEP. Some commercial insurances do pay for PrEP. For those commercial insurances that do not pay for PrEP, we do have the Gilead Prescription Assistance Program. And then we also have some other programs that have become available really within the last year that may even have someone who doesn't have any insurance to give them the option of making sure that Truvada or Descovy, so PrEP, is available to them. For us, we do a lot of that legwork for you, but sometimes that requires information from you to be given directly, for instance, to your insurance company. So we guide you through that process. And if you were seeing, the PrEP navigation program at Delaware HIV Consortium, they would help guide you through that as well. We've been pretty successful. We've been pretty successful about getting people PrEP who we think qualify, and they do qualify for it, but there are some times that we are less successful than we would like to be. Doesn't mean that we give up. You should consider that, just because you had initial lab work and you continue on PrEP and you decide that you want to take your PrEP medication daily, like we're probably going to recommend, then at that point you are going to have lab work done about every 3 months. It's not elaborate lab work, but part of that is just to make sure that we know your HIV status every 3 months, we know your kidney function every 3 months, and then there's some other things as well. I tend to also screen for STDs. So if someone's been in a relationship or not in a relationship and they've had, some sexual or higher risk sexual encounters, and they have not been protected, there's normally counseling about making sure that condoms are used and that people are protected. But at the same time, if there's any concern, then we'll do additional STD testing as well. Most of the time, people do feel that they know that they have an STD, but there are times that they don't. They might not have any symptoms at all. And if they don't know, then they can pass that on. And that's partly why I guess I have a job as an infectious disease doctor. So I do want to keep you all safe, but at the same time, that's why it's so important to be frank about your sexual history. Again, no judging, just to make sure that I'm screening you as appropriate as possible. Again, that's a lot of information. And Sal, I should probably stop there for a minute or two and see if there's questions that have come in that maybe I can answer, and to see if there's more of a discussion that you want to have. So I can pass it back to you for a little bit if you like.
Sure, let me get my camera back on. There we go. And I can unspotlight you. Hey, so give me 1 second here. There we go. So we do have a couple questions. And if anyone wants to chime in, you can do in the chat box, or if you want to unmute, I can unmute people. Why don't I go ahead and unmute folks right now? And if anyone has any questions, we can go with questions. And if not, that's okay also. So let me unmute folks. So we do have 2 questions. One from Facebook, which is, can you talk about on-demand PrEP? What is that? We've heard of PrEP 211. Is this safe? What is the research showing? What's the efficiency or effectiveness of PrEP every day versus PrEP 211?
Yeah, so that's a really good question. So on-demand PrEP is actually, is very effective if taken the right way. So I'm going to tell you that daily PrEP, so someone who is taking it on a regular basis, the statistics are still higher than someone who is taking on-demand PrEP, which I think is really the crux of the conversation. I also want to point out that there's a few things that are important to note as well when you go to on-demand PrEP. While it has been, which is much more effective than not doing anything, and I don't want people to be discouraged from it because it is a very good option. It is important to recognize that when I gave some of those days of how long it might take to get some of the concentrations up, so I said a week for anal sex, up to 3 weeks really to get, for vaginal sex, and then really for IV drug users. If you use on-demand PrEP, which is generally a higher dose, and it's kind of like a burst to get higher concentrations in, you still don't have as high of a percentage of effectiveness as someone who has been taking it every day. The other issue is that with on-demand PrEP, if you have an encounter, you don't have your medicine with you, it becomes a little bit trickier as well. But yes, I think on-demand PrEP is obviously a very good option. It can be a little confusing, but it is a very good option to help decrease the risk of HIV transmission. I hope that's helpful.
It is, thank you. Robert Fleming, you have a question? If you want to go ahead and ask Dr. Bill, that's great.
Hi, good evening. I'm Robert.
Hi, Robert.
I have an insurance question. I have Blue Cross through the state of Delaware. I'm wondering whether you might be able to tell me what I could expect. I'm going to talk about some problems I had with other prescriptions in the past. One was my GP wasn't eligible to prescribe something. It required a specialist, such as like maybe somebody like you who's an infection specialist. Also, whether they would require the prescription to be pre-authorized or not, and whether you think they would pay for it or not.
Yeah.
Blue Cross with this.
So Robert, that's a good question. And I will tell you that we have had, so I'm going to give you my normal disclaimer, because Blue Cross has, not only do they have lots of different branches under their insurance, so I cannot umbrella them all under one. What I have found, and actually the infectious disease nurse is one of the participants in here, and I'm not going to call her out, but that's Angie Scott. And what we do, we have found over the last couple of years that Blue Cross Blue Shield has actually been one of the better commercial insurances to cover PrEP than some of our others. I cannot speak specifically for the state of Delaware program, but I will tell you that Blue Cross Blue Shield has been one of our better ones. Now, with that being said, we always kind of submit for prior authorization. And I will also tell you, we also play the game. So if you're someone who is eligible for Truvada, and you're also eligible for Descovy, and let's say they don't cover Truvada, but you are eligible for Descovy, then we will submit Descovy. So we do try a couple different ways. And if by chance that you are denied, then we have gone through, the prior authorization process, which is painful for you and I, to be honest with you, but we do that. And sometimes we are very successful at that as well.
The last thing which you didn't address is a GP or an internist under Blue Cross eligible to make the prescription, or will I need to go to a specialist like yourself, an infection disease specialist?
So generally, the answer to that first part is yes. If a general practitioner or an internist feel comfortable prescribing PrEP, there should not be an additional certification that allows them to prescribe this medication. But I guess the insurance, different insurances can make up their own kind of regulations. But I do know that there are primary care doctors out there that prescribe PrEP, and they do not have to be, for instance, an infectious disease specialist. Was that helpful?
Thank you. Yes, it was. Thank you.
So we have another question for you. Can you please verify that once a person starts PrEP, does that person take the meds daily forever?
So that's a really good conversation that I have with my patients frequently. So and actually this is where on-demand PrEP adds a little bit of adds a different avenue of possibility. So I won't talk too much more about that, but So I do tell people that, if they take PrEP, so let's think about what PrEP is used for. It's used for people who are put into a higher risk for transmission for HIV. So if that higher risk for transmission is no longer there, they no longer really need to take PrEP. For instance, so someone is taking PrEP because they are having several sexual partners. And even though they may be using condoms, which is good, and I want them to use condoms, they are still maybe having not necessarily anonymous sex, although they might be, but they also might be having just different sexual partners that increases their risk for HIV transmission. If they end up in a monogamous relationship for some time and their partner is monogamous and they've been tested and they both know their status, then at that point, I think that the high risk nature of why they went on PrEP in the first point is no longer there. And then at that point, we would talk about coming off of PrEP. So that's just one of different examples. Again, I know we're focused on kind of PrEP from a sexual standpoint, but the same thing will go for someone who uses intravenous drugs. If someone is on PrEP because their high risk factor is using intravenous drugs, potentially sharing, needles and equipment, and they become clean and sober and they don't do that, or, they no longer share and they're a part of a needle share program, or a clean needle program, then at that point, that risk has significantly decreased, and we would talk about that.
All right, so our next question is a technical question. One of my testers and counselors had a question about storage. So would you talk for a minute about storage of PrEP? A lot of our camp clients in Western Sussex are homeless and have no access to refrigeration and controlled humidity. Can you please address that about the stability of PrEP meds?
Yeah, I'm going to do my best to talk about that. Normally, when it comes to these medications, they don't necessarily need to be refrigerated, but the caveat is exactly what they're bringing up, is that if it's someone who is homeless that's in extreme temperatures, the medication ideally, I'm going to answer this as I'm supposed to, the medication technically can degrade over certain temperatures. Descovy and Truvada, while very similar, are different medications, and I would tell you that I would probably have to look up to see what exactly that temperature range is, which I'm trying to do on the side right now, but they do have specific storages for them, and that if it does not meet that, then we do run into some issues. On the other hand, I have taken care of, and I'm not saying this is the right answer, so here's my caveat to this, right? So my caveat is that I have taken care of homeless people on antiretroviral therapy before, and I have never had anyone clinically fail because they've not been able to put their medication in a refrigerator. So I cannot tell you that that is the answer, but I can tell you that really there are storage limits to what that medication can be, where that medication should be stored. Doesn't have to be in a refrigerator or freezer, but room temperature is really where it is supposed to be. I hope that helps. I know that's not a great answer.
So we have a Facebook question. I've heard about getting a shot once a month for PrEP. Is that really going to happen, or is that just science fiction?
I like that. I like that. Well, science fiction eventually will potentially become reality. So what we're finding, and what some of, where one of the modalities, so if you allow me to switch gears for a second to actually talk about HIV treatment. So one of the newer modalities with HIV treatment is that those with HIV who qualify would come in to have an injection or 2 injections that would occur anywhere from every 30 to 90 days. So for instance, I have HIV and I come in and I would go to see, for instance, my nurse, since I've already called her out, Angie. I would see her every 2 to 3 months, depending on which medication. It would be coordinated and synced up. I would get 1 or 2 injections, likely on the backside, just so everybody's aware. But that would ideally stop me from taking pills every day. 60 days later, I come back and I get my injections again. Again, not taking pills in between that. And then again, 60 days later, I come back. So that same focus and modality could be considered for PrEP, and is kind of being talked about. So I would not call that science fiction, although we do not have anything approved on the market right now. I absolutely foresee that to be something that would be in the future.
And at this time, does anyone else have any other questions? And if not, that's okay. I'm gonna unspotlight you, or I'm gonna take. There we go. I forgot to press myself off of mute. Sorry about that. So at this point, what I'm gonna do is I'm gonna share my screen. We talked a little bit about resources. Maybe this will get some other questions going. So let me do this here. So there's a couple really good resources here in Delaware. Dr. Bill was talking about the PrEP locator. Let me just get what's here. So the PrEP locator, you would type in and then you can see it populated where you can find information about PrEP in our area. So this is a great resource that Dr. Bill was talking about. The Delaware HIV Consortium has a PrEP navigation program. So if you're looking to get information about PrEP, you are asking questions about insurance or how to pay for PrEP, there is a great program out of Wilmington, out of the consortium. All you got to do is just fill out this navigation link here, and you can schedule an appointment with the PrEP navigator. And the other resource that we have here in Sussex County is the HIV Wellness Clinic. It's located at the Georgetown Wellness, the Stokely Center in Georgetown. There are a few doctors there that will prescribe PrEP for people that are not living with HIV. You don't have to be a client of that clinic. So we definitely have options here in Sussex County. And I know Paula Wood is on this call. She works for public health in the PrEP arena. And she just wanted to remind you all out there that there are a few programs that will help pay for meds. If the insurance company underinsures or doesn't cover the meds, you can reach out to me at Camp Rehoboth, or email me, call me, and then I can get you connected with Paula Wood. So does anyone else have any questions at this time? And if not, again, that's okay. Or if Dr. Bill, do you have any closing thoughts? Thank you again for doing this evening. I think it was very helpful for those of us on the call, and definitely for all those out who've been watching this via Facebook. So I really appreciate your time this evening. Thank you.
And Sal, if I can introduce one of my, I'd like to introduce a couple people, if that's okay, just so that the faces are out there. And I know that I appreciate everybody who's on here. And Paula, this is helpful because actually, I don't know what you really look like, but I've heard your name a lot. So these are always great ways to at least see what people look like. Hi, Paula. I'm going to ask Angie Scott I'm going to ask Angie Scott and to Stephen Kaiser both to I don't know, do you say unmute your video? I don't know if that's a legit Zoom term or not, but anyway. I also want to introduce a new colleague of mine, Dr. Matthews, Sarah Matthews, who on my top screen is next door. And she is internal medicine and palliative care trained, but she is going to be working with myself and our ongoing efforts with Camp Rehoboth to see how we can continue to collaborate and provide some of these services really with, with you, Sal, and to expand our services. So I just wanted you all to know what Dr. Matthews and Sarah looks like. And then the other two people that I wanted you to see is Angie Scott, who has that nice facade in the back, that she's in a dark room just with a spotlight. Angie is the infectious disease nurse at Beebe Healthcare. So Paul, I wanted you to see what she looked like as well. And Sarah, I don't know if you have had the opportunity to meet Angie, but I just think it's a small world, even smaller down here, that I wanted us all to know what each other look like. And then I'm not sure if Stephen Kaiser is able to, there he is. I wanted you to see, he looks like he is launching helicopters and airplanes right now with his headset, but I wanted you all to meet him as well. He is our Vice President of Operations for Beebe Medical Group, and he obviously has a lot of passion around Camp Rehoboth. So Sal, if there's anything that he can do for you, Paula, you know, he's one of unknown Camp Rehoboth's biggest fans as well. So I just wanted you to meet some of the cast and characters from Beebe. Thank you.
Very awesome.
Yeah, nice meeting everyone. And thank you again for all of you out there spending your time with us this evening. Dr. Bill, I owe you a lot for all you bring for our community. I've only known you a short time. I met you back at World AIDS Day last year, and I said I need to get up with him because he's the new hot doctor at Beebe serving our community. So thank you for being here. And I know you've done so much for the LGBTQ plus community already. So thank you. And thank you everyone for spending your night here. And I'm Salvatore at camprehoboth.com if you have any other questions. And I hope everyone has a good night. And thank you again for spending a portion of it with us. And Dr. Bill, thank you so much from the bottom of my heart. I really appreciate it. Thank you.
Thank you to everyone who joined. And Sal, thank you for having all of us. Thank you.
And have a good night, everyone. Thank you.